Is that something I should have known?
No.
So other people might make that mistake too?
Uh-huh.
All right. I'm gonna go do that real quick while we're waiting on people.
Yep. You need your insurance card.
Oh, I do? Well, then I'll wait.
Uh-huh.
Hey, Jesse. Thank you. We're still waiting on the folks who said they were coming. So we'll give them a few more minutes. Hey, Rebecca. How are you today?
Hi, how are you?
Good, thanks. So good. There's Judy. Hey, Judy. And Sina said she was coming too. So if you don't mind, we'll just wait a couple more minutes.
Yep.
All right, Laura, are we expecting anyone else?
And our new person.
And our new person, right? Hey, Sina, how are you?
Hello. I'm talking on mute.
We have a new member who's joining us today. I talked with him Friday afternoon, so let's give him just a minute to see if he logs on, and then we'll get started, okay? Shayla is not going to be here today, so I'm going to lead the discussion. And Rebecca, I saw your note that you need to leave by 1:15.
Our back to school is at 4.
It was a sad sight to see buses with windows closed and kids masked. It was hard to watch this morning. And I don't even have any little kids anymore.
Well, we're trying to pull together carpools in my neighborhood because we don't have bus service. It's just we don't have enough bus drivers.
Yep, we're doing the same in my neighborhood. It's pretty complicated, but it'll be nice if each parent can do, 4 or 5 rides a week instead of 20.
Yeah, right now we have it. I have it split with another friend. But I'm actually reaching out to a few other people to see if we can try to make it a little bit bigger.
All right, well, it's a few minutes after 12. I'm hoping that our new member, Sahir Zakar, and I apologize if I bungled his last name. I spoke with him on Friday, and he is in his residency at UVA, so he may have gotten caught up in a clinic and be joining us soon. But if he joins us, we'll stop just so he can introduce himself. But we do have Jesse Williams, one of our family services specialists who works in foster care with us today. He's also leading our racial awareness during crisis work group. And one of the things Rebecca had asked about was our research that we've done with UVA into disproportionality and disparity in our child welfare caseload. And Jesse's going to talk a little bit about what his group is doing and how they're looking at the information that the research projects delivered to us. So first then, since he's here, let's start with introductions. And I apologize, I want to make sure everybody heard. Shayla is not here today, so I am leading the discussion. She's newly married, for those of you that don't know that. So hopefully she's still celebrating that. So I'm Sue Moffat. I'm the director of the department. And I'll just call folks out as you appear on my screen. Okay, Judy?
Judy, you're
You're
muted.
muted. Hey, Judy.
Here I am. Okay, thanks. Usually that doesn't happen. I've been on the advisory committee for 2 terms. I'm a retired social worker and I've lived in Charlottesville 15 years.
Sina?
Sina McGill, currently serving on city council as the vice mayor. Previously, though, I worked in homelessness with Patcham, and I worked for 11 years at Region 10 in intensive services. And I also have a child in the school system, so.
Rebecca?
Hey, I'm Rebecca Menning, foster parent, though not currently, and involved in anti-racism work in a number of different capacities around town.
Sherry, hi. I want to make sure you heard that Shayla's not here today, so I'm going to be leading the meeting. We're just starting with introductions for 2 reasons. One, we have our staff member here to do a presentation on our racial awareness during crisis work group, but also we're expecting a new member who has not yet logged on. So would you just briefly introduce yourself?
Sure. I'm Sherry Stewart. I work for the Charlottesville City Schools K-12 English Learners Program as a family engagement liaison. And I teach ESL to adults through PVCC, TJ ACE, which is adult education. And I work mostly with refugees and immigrants. And I have 2 children in the city schools, and I just took my first child off to college.
Oh. I just took my youngest child off to college. It gets easier.
Actually, I was better than her. I was like, go have fun.
Thanks, Sherry. Laura?
Laura Morris, I'm the Chief of Administration with the department.
Okay. And I see we have an attendee that looks like it's our Deputy City Manager for Race, Equity, Diversity, and Inclusion, Ashley Marshall. Welcome, Ashley. Did you want to say anything? Maybe she can't. I'm sorry. I'm new at this attendee versus panelist aspect. Okay. Text me if you do, Ashley, okay? And we'll make sure it gets entered into the official record. All right, so any comments from the public at this point? All right, if not, if you're okay, I'd like to go ahead and move into discussion with Jesse so we can free up his time, and then we'll move on to the other portions of our agenda. Any objections to that? Okay, Jesse, I'm handing this the floor over to you. Thanks for joining us today, and please start by introducing yourself.
Yeah, absolutely. Thanks for having me. Well, Sue did a nice job of introducing me earlier, but I'll go ahead and Jesse Williams. I've been with social services with the city for a little over 4 years now, in foster care the entire time. So yeah, that's me. Should I just give sort of an overview of the work group? Is that what you all would like?
Yes, that's what we were looking for. Why it got started, who's participating, what tools you've already developed, and then the new work with the research studies. Okay.
Sure. All right. So, my little kitten is distracting me right now. So the work group, yeah. So the racial awareness during crisis work group is the group that I currently facilitate right now. And just to give you all a little bit of background, since I've been with the city, I've done a fair amount of like after hours on call work for CPS. So a little bit out of my foster care realm, but I've gained some experience in that area since I've been working with the city. And so really that kind of opened my eyes a little more to some of the racial issues that are present in sort of response during crisis situations. And so last year, August of 2020, I started the racial awareness during crisis work group. And the idea for the work group was born out of this just kind of seeing how different situations were handled on call, with clients of color, and seeing how police interacted and other like emergency maybe people in the community responded in those situations, and seeing how they were treated, and just knowing that there had to be something better, a better way to approach crises, a better way to bring awareness and knowledge of racial disparities and racial issues within that area. And so, talking with some folks, at DSS, really decided that this was sort of the way to go to start addressing some of these issues. And so it really kind of started with wanting to create one, racial awareness, but also how to respond to like mental health crises and emergencies where we could bring more resources than just what the police could offer. So I felt that a lot of times having the police respond was kind of a default, even if it wasn't really sort of the police expertise. And my thought was that there had to be other ways in which to handle and respond to mental health crises, especially with I saw youth that I worked with personally that went through crises and ended up not having great experiences with law enforcement and their families, and these were people of color. And so with that, and with the extra layer of racial trauma in the Charlottesville community, just decided to take a closer look at that. And the work group is comprised of members from all different departments across the agency. So CPS, foster care, prevention, we have folks benefits, folks from the VIEW team. So there's a lot, it just brings in a lot of folks with different perspectives that work in different areas of the department. And really the first thing that we wanted to look at was the agency. What can we do as an agency to better respond, to have more intention and awareness around race in these situations? And so what we realized was there were some gaps in the training. There were some gaps in the training that we were receiving as workers around responding to on-call. And so what the first thing that the worker really tackled was how to create a training guide for new workers who come in, and existing workers for on-call, and just giving sort of just an overview of what to expect, how to approach on-call, what issues may come up, how does race, how does bias impact our responses? And so just, creating that for the agency. And that's an ongoing process that they're still working on, really trying to hone and, just put it into the implementation stage. We also looked at creating some tools for workers, such as, so it's called the What to Consider checklist. And so it's a checklist that kind of goes through, if you're responding to a situation on call, what should you be thinking about safety wise, just to kind of slow down the thinking, because one thing we know from research is that the implicit bias, when that comes in, is when things are going really fast and you're making snap decisions, snap judgments. And so we wanted to create this tool to kind of slow things down and make things more intentional, and really give the workers time to like process, how are we making these decisions and why. The other thing that we worked on doing is creating a list of resources in the community in Charlottesville and beyond, because sometimes we also work in the surrounding area, of resources that really would be useful in a crisis. So, other than maybe law enforcement. So we wanted to really identify, other agencies, organizations, things, just resources that would help our clients in these after hours weekend situations, that would maybe give them a little more of a trauma informed, somebody with mental health expertise that would be able to really kind of deal with these circumstances. I know I'm going 100 miles an hour here, so slow me down. If you have any questions, I'm just trying to pull up all the things from memory that the group has worked on in the past year. So that's kind of where the group started. We really focused on call, the crisis situations, right? And so, then I think as the group has evolved, we started to branch out a little bit more into maybe just the more general, like racial awareness part of it. So, one of the things we thought would be useful to the agency is bringing Dr. Michelle Claiborne who is from UVA and has done multiple studies with our agency about racial disparity that exists both in CPS and in foster care. And, those studies have been done over the last maybe 3 or 4 years. And so we have all this data, and, we wanted to kind of reignite some of that and present that to the agency. And hopefully that would be useful to creating maybe some trainings or other things for workers, ways that we can, as an agency, be more intentional around race. So Dr. Michelle Claiborne, the work group organized and arranged for her to present this information to the agency. And it was a really good turnout with the agency. I was really pleased, and she made a wonderful presentation about some of the results of the studies that she and her team did at UVA. I can go into a little more specifics, but I'll spare you all this time to kind of delve into some of that. But what it kind of led us to ultimately was that our agency, there's some things that we need to implement as far as like training workers. So we don't, there's not a lot of trainings that address bias, that address race. And so I think knowing that these disparities exist within our practices, with our agency, I think starting with us as workers and what are our, how do we think, what are our beliefs, values? And so, taking more of a personal approach to it and creating some trainings to create some awareness, I think will just, show up in our practice as a whole. So I think the idea was to take some of these studies and look at how we can train workers, and using some of the data as well. And the other thing was looking at where a lot of the CPS referrals come from, what different sectors in the community. And as an agency, maybe we aren't able to control where our referrals come in and who those referrals come in for. But what community partners can we reach out to and collaborate with as far as getting information, about what we could do better as an agency in the community, how we interact with the public, how we work with other agencies that may be able to provide resources. And so this last part I'm talking about is more in the early stages of trying to really figure out like who are those partners, how can we get good feedback, where can we go from here. And so this group meets monthly, and we we have sort of like an action plan that we're working off of. And those are a lot of kind of the big picture things right now that we're working on. And other things might come to me, but I'll stop there for a second if anyone has questions or thoughts.
I have a question. Can you hear me?
Yes.
Hi, Judy Zeitler here. Thank you so much. I really appreciate learning about this group. I have a question. Are there any protocols that you're working with the police when they're called in? Is there a way of bringing in workers for mental health issues with police? Is there any joint effort to make that happen?
So this idea what you're talking about has been brought up in the group. And I think, I believe that there are people in the community that are probably working on this. Our group has not really addressed that yet. I think where we're approaching this issue from is when we are in interaction with the police in these crisis after hour situations, how can we be intentional about our communication with them? We're not always in control about when they respond because they have their own protocols. And so a lot of times it's about, how can we bring information into that situation and be able to kind of mediate when needed. I will say that it's the focus of the group has been more so on interagency, like how as an agency can we improve and can we grow in our knowledge and around race and bias. So it hasn't really got to the point where we've really addressed how can we collaborate with the police.
How many people are in the work group?
So core members, I would say members that have been there since the beginning that attend regularly, there's at least 10 to 15, and as many, I would say people would probably attend on a semi-regular basis, probably upwards of 20 people.
Wow, okay, that's a nice number. Also, is there a way in our minutes the next time that we can actually see your checklist and the resources?
Absolutely, yeah.
That would be helpful for me to see those.
I can send you all anything you'd like. Yeah, I can absolutely.
Great. Maybe Laura can put them in our minutes or something. Thank you so much, Jesse.
Absolutely.
Rebecca, did you have a question?
Thanks, Jesse. This is it's super helpful, and I'm excited about the work you guys are doing. So thank you for being here. My question is, how can this board support this work, either as a group or even us as individuals? Like personally, this really resonates. And so I love to hear how I can or we can be supportive.
Absolutely, yeah. The first thing that comes to the top of my mind is, worker trainings. I know that there are a lot of great trainings that come in when around orientation for new workers. And there's a lot of great trainings that are not really mandatory, but they're sort of, suggested, recommended by the agency as workers, attending. I know we've gone through some great trainings around bias, things of that nature. I would like it if the board could support, trainings that would be like ongoing trainings for the agency where workers come in and we have dialogue about race and bias, because to my knowledge, there's nothing that really exists with that in the agency. And I think it's so important, and at every level, really. And so if there's a way to, and I do think there's probably some efforts going into maybe citywide looking at some trainings, but I think the board supporting, that sort of, those trainings being implemented.
Sherry?
Hey, I'm sorry if I missed this, if you already said this, but as far as getting information from, oh, I have an echo. Getting information from people who've been affected by this, how are you going about doing a survey or reaching out to folks to get information from them? Are you using an outside source so that they don't feel, I don't know, I feel like it could be uncomfortable. They may answer differently if it's somebody from CPS that's coming to ask them those questions. And is there some kind of anonymous way that they can give you guys information, like a hotline or like a form, a Google form that they can submit or something like that?
That is a great question. And Sue may have some information on that too, because I do think there's probably ways that they can give feedback anonymously through maybe the state. So we have not really figured this one out yet. There have been times since I've been at the agency, and maybe there's been efforts made before I was there, where we've tried to send out surveys and maybe do that through providers with clients rather than having it be through like their social worker. And there wasn't a lot of participation. We didn't really get a lot back. And so that is something that the group has really touched on, is how can we get this information? Who can we get it from? How can we, because I do think it's important to get information from the community, from our clients, and what their experience is. And so, we just haven't really figured out how to really do that. And Sue, maybe you could speak to.
Oh, you're absolutely right. It's something that Laura and I have been working on. We have not filled the assistant director position, and we're looking to convert that to a CQI or data analyst type of position to help us to increase our capacity to look at those things. Right now, it's really just anecdotal analysis of how engaged are people as they move through the continuum of child welfare, but we don't have a really, Jesse's absolutely right. We haven't figured that out yet, but it is definitely something we're looking to make some progress on this year.
I would think that, I could be wrong, maybe Stina has an idea about this, but I would think that face-to-face conversations would make more sense than filling out surveys, because I mean, we have a hard time getting families to fill out surveys for the schools. And I think if somebody's asking them questions, somebody that has a trusted relationship with them, or if there's somebody who's a representative like an ombudsman or something, this is the person that you go to when you have a problem, and they are, not necessarily heavily involved with the organization, or maybe just on the outskirts of it, so that there's no judgment or bias or anything like that.
Yeah, we do have a a parent navigator who is a peer position connected to our foster care team. And we are just getting ready to add an additional peer parent navigator connected to our foster care prevention team. So we're hopeful that that will also give us more opportunities for that type of feedback. The problem is they're still connected to the department. So we do have to be aware of that, that not, you know, having a social worker come knocking on your door is not always the most helpful situation. We're very, very rarely there because things are going well. So from the get-go, it's a challenge, and our workers are really skilled at being sensitive to the challenge that they present when they knock on that door, and work really hard to develop a relationship with the family.
Sue, do they ever go, I know I've seen tables at certain events, but I can't remember which ones, but I'm just wondering if joining community days or unity days at the different neighborhoods in a time where there's not a crisis, I'm sure you do some of that. Maybe you can talk about that.
Yeah, that was, I don't want to steal all of Jesse's time, but that was one of the initiatives that came out of our original study, is to find other ways to develop relationships that weren't just based on the services that we had to do. So we're regular participants pre-COVID in all of that, the Tonsor Park Fair, the West Haven Day Fair, the back to school nights, various church events. Anytime we get an invite, we participate, and we're pretty active with the Trauma Informed Care Network. We have representation on the steering committee and also in the peer-to-peer training group. So anytime that group is connected somewhere, we are also a part of that. Two other things I wanted just to point out real quick about those studies that we did do. For the CPS aspect, the data that addresses the CPS reporting, we have developed a training, actually we're just tweaked existing training called Buzzwords, which we provide to all our mandatory reporters and our staff. The language that you use when you make a report, whether or not it gets validated. So that, you know, the crazy family that lives on such and such an address, instead of just making your report fact-based, that it challenges your own implicit bias if you just stick to the facts without any descriptors. And in companion to that, again, this is very difficult during COVID, but our numbers are very small, so it takes a long time to discern a meaningful impact of a change. But we started a blind referral process where when we validate a CPS referral that comes into the agency, prior to that, to getting started on the investigation, the intake worker also does a check with a staff that's just fact-based. There's no demographics involved at all. So the name, the address, everything is removed. It's just the circumstances of the report and the age of the child. Because oftentimes, you know, we're fortunate that we have staff that have been connected with the families in our community for a while. But sometimes if it's the second or third report you're getting on that same family, you might make some assumptions that, or we might make some assumptions about validating a case that maybe doesn't need to be validated. Or the reporter might make some assumptions about that, which is more likely the case. And the third thing is we diverted some money to the schools to manage financial crises that in order to avoid them having to make a CPS report for, say, an unstably housed family, or if there were no other circumstances other than a financial need, the schools now have a little more ability to address those crises without having to make a child welfare report. Right. Jesse, anything else you want to add about that? Uh-oh, I don't know where he went. While we're waiting for Jesse to get back on, Sina, maybe a very quick summary about the Marcus Alert work group might be helpful for some of the questions Judy was asking.
Yeah, so, you know, we're still struggling with this because in a lot of ways, it just gets really huge. And we just see what the incredible need is in the community. And then, you know, we turn around and everything's already tight it is. And then the state is now closed new admittance 5 of the big hospitals, including the geriatric and juvenile facility. Region 10 had put in for a grant for a 23-bed crisis, 23-hour chair crisis stabilization. Regretfully was not granted by the state the money to do so. We will be making a presentation on September 28th with the mayor's Imagining a Just Charlottesville group. At that time, we're going to try to put together what our recommendations are for what a more permanent group does, and what it starts looking at, and who we recommend the members be, and also who we recommend to lead it. We also are kind of struggling with how to get some sort of survey or data collection into the community that will actually have people participate and feel free to be honest about their participation. And we've decided on recommending a combination of both a multiple choice answer, so you can get some very hard number data that fits into a graph, but also have about some of the questions be very open-ended for experiential data, so that people can put into their own words. And we have identified that what we're probably going to recommend to the city to do is utilize some of the groups who are going around, like Peace in the Streets and Buck Squad, and other groups who might have a little bit better rapport than other people who might be considered at times to come into a community to take away or to disrupt the community versus to help be there in a helpful role. So it's we just keep identifying difficulties, but I think we're finally getting to that point where we can start recommending actual movement. I mean, the big one is we want to make sure it's designed from the very beginning to hear from people who are using the system and running into problems that haven't necessarily historically been heard. And I'm proud of our whole city, as I really feel that our city government and everyone in it is really trying to make this change. It's been going on for years, but it's really been picking up momentum of instead of the do for attitude to you are the best person who understands what's going on in your life and what the hurdles are in your life and how can we help you get over those hurdles. You tell us how we can help. And I've been watching that change happening for over a decade now. And I just think this group is part of that change forward. So the other thing we really identified is that whoever does go out needs to really be trained in motivational interviewing and not just asking the questions, but being able to interpret to be able to translate sometimes the questions to different people. Because sometimes it's hard if someone just says, well, what's your experience with the police? Or have you ever had an experience with mental health? That's going to mean someone's going to say, like when I worked in homelessness, sometimes if you just ask the straight up question, it didn't mean the same thing to everybody. And somebody would say, no. I just get, well, I've got some anger issues sometimes, or, you had to learn how to interpret what somebody called something. Diabetes was often called the sugar. Well, no, I'm not sick. I just have the sugar. It's like, wait a second. Okay. Yes, that's diabetes. That's an illness. We need to write that down. So it's how to ask questions and then translate those questions and answers in a crossover.
So Sina's work group, a very basic summary, it is focused on an alternate response to mental health crises other than law enforcement or to supplement law enforcement. And Jesse's is really, the work that he's doing is focused on responses that are required for our cases, not the whole community. Hey, Jesse, anything else you wanted to add, or does anybody have any other questions for Jesse?
Thanks for the work you're doing, Jesse.
Well, I appreciate your time. Thank you all.
Last call, anything else? Hey, thank you, Jesse, very much for your great work and for your time today. Appreciate it.
Hope you all have a good rest of the day.
Thanks for joining us. Right. So we're happy to take any questions that come up as you think about that. And Jesse, we'll get the tools that Jesse mentioned out to you all with the minutes for the meeting, okay? I skipped over approval of the minutes, and that's because we don't have a quorum today. So the next item on the agenda is members report. Anything from you all to relay from your respective agencies or your perspectives? Jerry?
I just in case anybody didn't know, Albemarle started today, but we don't start until Wednesday for the K through 12. And the adult education classes start on the 13th of September, and they are free. So if you have any folks who need a GED, ESL or workforce training, we do CNA. They have various classes. Have them call the TJ ACE at 961-5461. And wear your mask, I guess, and hope that Delta doesn't close us down.
Anything from anybody else? Okay, I'll move on to some information from the department. Actually, I'm going to lean on Laura to talk about the annual report and the vacancies for the board. But before we get to that, I just wanted to give you all an update on where we stand with reopening. You may have heard the city is likely not going to open to the public with certain exceptions by appointment until October 18th or 19th, whatever that Monday is. Our department continues to be open to business. For business, we're working primarily remotely. All our contacts for our service programs are being done in the field in people's houses or at parks or whatever is appropriate. We're masked up. We're asking the COVID screening questions before we go out, giving families the option to meet us in an open air space instead of a closed space. We have seen some staff exposures. Thankfully, we do have a high vaccination rate, and we have not in recent months had any significant staff illness related to the pandemic. We are anticipating continuing our current business model, even once the city the city buildings open up to public. Our public assistance programs have actually seen a much better retention rate. We're not closing cases. First of all, many of the program policies changed to say you can't close the cases right now, but we're just finding that it's easier for people to manage their business with us if they don't have to come into the office, much like, you know, online banking. Folks have a lot more control over when they engage with us, how they provide information, and we're really moving to only seeing people face to face when they have a need to or when we are required to. That I haven't gotten a single client complain about that, but again, that's something that we're going to really we're going to need to stay on top of. We want to be hyper vigilant for any gaps in service provision so that we can address them quickly once we are open for business. And a big unknown is what's going to happen with the schools. Many of our staff have children, and frankly, just a more flexible work schedule, while they're certainly still working their 40 hours, is better staff satisfaction. So it's a win-win right now, but we are keeping a very close eye on it. The leadership team will likely each take a day in the office. That's kind of what we've settled on now, where we are a pretty tight-knit group, and there is really very little need for us to actually be in the office except to just walk around and check in on folks who are there. Laura, can you talk a little bit about the vacancies we have on the board and then the annual report? Since I'm new to this, Laura is really the institutional knowledge about the annual report.
So annual report, we're supposed to do one every year, normally around budget time. And I'm guessing from our last meeting, Shayla was going to touch base with you, Sue, and I'm guessing that hasn't happened.
That is correct.
Okay, so if you guys have any topics that you would like included, just send them to us by email and we will compile a list and get them to Shayla. And for advisory board vacancies, we currently have 2. Applications are being accepted until September 10th. So if you know anyone who is a city resident and would be interested in applying, please encourage them. And they have to apply online. There are no more paper applications. And after this meeting, I'll send you a link to the application.
Great, thank you very much. Any questions about any of that? Okay, and any other opportunity for public comment? Hearing none and seeing none other than the deputy city manager. I think that closes the meeting for now. Wait, sorry. I do want to make sure that you know, once the city does lift its emergency order and the buildings are open for the public, this advisory board is one of the bodies that will be required to meet in person. Hybrid meeting will no longer be an option for us, and electronic meeting will no longer be an option. So I know that was a concern for you all. I'm sorry, I meant to mention that up front. Vice Mayor Miguel.
I just wanted to really quickly, so in October, that is either when we'll be opening back up or another emergency ordinance will be passed, depending on how we see Delta going. I just wanted to, it's not 100% set in stone that October will be reopening. But that's just the earliest it can reopen at this point.
Thank you. Okay, anything else for today before we officially close the meeting? Laura, do I need a motion to close the meeting?
No, because it wouldn't pass since we don't have a quorum.
Oh, because there's a quorum. That's right. Okie dokie. Then that's it for now. We're still on our posture is still, we're meeting every other month. And if it is going to be an in-person meeting, which would take us to October, right? We'll send out the information to you. Okay.
Thank you.
Thank you very much for your time, everybody.
Thank you.
Well, stay
Great.
well.
Take care.
Bye-bye.
Bye.